President Jimmy Carter has been receiving hospice care for a year now. Haley is learning more about the oldest living president's stay.
Yeah, hospice care can be helpful during end-of-life stages by providing comfort and support to patients and their family. The 99-year-old former president marked 1 year in hospice care on Sunday. He survived metastatic brain cancer, liver cancer, and a number of other health scares, including brain surgery. But his grandson, Jason Carter, says his spirit is as strong as ever. So while we know how long someone can live, Superb Hospice says the average length of time someone typically survives in hospice is 70 days. So joining me right now to discuss long-term stay in hospice care is Chief Medical Officer for the American Academy of Hospice and Palliative Medicine, Dr. Joe Rotella. Thanks so much for joining us.
Well, thanks for having me.
So tell us about hospice care. For anybody who is not familiar with it, what are the types of services and treatments that you offer?
Well, I love having an opportunity to talk about hospice care. In my decades of service as a hospice medical director and now with the American Academy of Hospice and Palliative Medicine, I've seen over and over again what a difference hospice care can make for patients and families. It's really like nothing else in medicine. It's an intensive form of medical care provided by a team of professionals, not just your doctors, but a hospice medical director, nurses, social worker, chaplain, pharmacist, whoever is needed, that puts the patient and family at the center of the care. It's all focused on what matters most to the patient. And it can have a tremendous impact on living as fully as you can in the last days of life.
So we were talking
more than that. Let me say more than the last days, months, and sometimes a year or more, as we've seen with President Carter.
Yeah, that's what I was going to ask you about, is if that's a normal length of stay, or if people typically don't stay in hospice care that long.
Well, you know, I've seen what can happen if people can have hospice for more than a few days or a few weeks, and I want to talk a little bit about that. But what we see right now is that most people, more than half of folks who receive hospice care get it for less than 3 weeks. Okay. And about half of the folks with Medicare who die don't get hospice care at all. So here's this great service that people are either not getting or they're only getting for a very short time. When hospice starts, it's very often the case that the patient and family are in some sort of a crisis. They may have uncontrolled symptoms like pain or shortness of breath or nausea, care needs, financial concerns, emotional distress. And when that hospice team comes in, they try to address all those things based on what's important to the patient. And it may take a few days to get the medications adjusted, the equipment in place, the team up and mobilized. And when we get through that crisis and now the patient is comfortable, the family is supported, everybody knows what to expect, the team is in place, 24/7 coverage is in place, then people can focus on other things like my bucket list or the legacy a person would like to leave, or healing relationships. The real magic occurs when the patient comes out of the crisis and the hospice team is supporting them and their family. And so if you can get it for more than a few days or a few weeks, that's fantastic.
Yeah, and
it's unusual to go a year.
Yeah.
But we see that fairly often.
But Dr. Rotella, I'm sure you understand that families have, it's really difficult for them to make the decision to go into hospice care. So most of the time they wait until they get to that point of crisis that you're talking about. Is it a better idea to go into hospice sooner? I mean, how do you make that decision sooner without the hope of they're going to get better?
Well, so it definitely is better to get your hospice care, at the right time so that you can benefit from it for more than just days or weeks. But you're right that often people wait for their doctor to bring it up, or they, maybe they're afraid to talk about it, and that can lead to a delay. I really encourage people to talk to their doctors and families. If there are uncontrolled pain or symptoms, If things have been getting worse despite your best efforts, if you've been in and out of the hospital a few times and you're not getting better, it doesn't hurt to ask about hospice.
Yeah.
You know, if it's not time, the hospice team will tell you that.
Like, we're not
But
ready for you yet.
I really encourage people to talk to their doctors. They can go to our website, palliativedoctors.org, and learn more about it there, too.
Yeah, you know what I've heard from my personal experiences with people I've known who went into hospice is that they waited so long to get there, and then it ended up being such a peaceful transition. So do you hear that from a lot of people?
Oh, absolutely. And then what I hear, and it kind of breaks my heart, is, boy, we sure wish we had gotten this sooner.
Yeah.
And that's why I'm so grateful that President Carter and his family made the decision to go public with their decision to enter hospice care, because that has really raised awareness. It's why we're having conversations like we're having right now.
Yeah.
People are interested in hospice. They want to learn more about it. And I think the result will be that more people will get the full benefit of hospice care.
Yeah, I mean, if the care is good enough for a former president, then it's good enough for us. Dr. Joe Rotella, I don't have any more questions for you. Is there anything that you'd like people to know before I let you go today?
Just don't be afraid to ask. If you are not feeling your best and living to your fullest, ask your doctor about hospice care. It's okay if it's too early, but you want to get it in time. So thank you so much for this opportunity to talk with you.
Yeah, that was all great information, Dr. Joe Rotella, and we will, of course, clip this and put it on our website, click2houston.com. Thank you so much for joining us this morning.
Thank you.